So you've been diagnosed with a rib fracture or a rib contusion. Here's what you need to know and a little bit about what you might like to know. So we may not actually know if it was a contusion or a bruise to your ribs or if it was an actual fracture or broken ribs. That's because x-rays don't actually see the fracture very well. In any case, it doesn't really matter. The main thing is pain control, because you must take deep breaths and cough. Normally, we all do these things, take deep breaths and cough without even thinking about it. And then when bacteria just gently fall into your lungs, we automatically cough every once in a while and it gets it out. And we take deep breaths and it opens up our lungs and gets out, again, any bacteria that's fallen inside. When you have a rib fracture, it hurts like heck to take a deep breath and even worse to cough. So people often hold the fracture and they won't take deep breaths. And if you don't take a deep breath, I guarantee you, you will be back in the emergency room with a pneumonia, a fever, and a cough, because the bacteria has settled inside and your body is at 37 degrees, nice and warm, a good place to grow bacteria, sort of like a petri dish. So you will end up growing yourself a pneumonia and you'll be back. So you must take deep breaths every 15 minutes, concentrate on doing it, and having a good cough every hour. The way to do that is to take the pain medication you were given in the emergency room. Start with your NSAIDs. This would be like ibuprofen or Motrin, or you may have been given Aleve or naproxen. Start with those. Take them as directed. Don't wait for the pain to happen. Just take them twice a day if it's naproxen, or 4 times a day if it's ibuprofen. Then, if you're still not having enough pain control such that you can take a deep breath, it just still hurts too much to do it, then you add on something stronger like Tylenol 3s or Percocets. Now, these are stronger. They do cause sedation, so don't drive or operate heavy machinery when you're taking them. And do be aware that they cause constipation. So just take whatever you have in the house for constipation, like Metamucil or Docusate, when you're taking them, because you know that's going to happen. You may as well get on top of it in advance. Obviously, avoid any strenuous activity or exercising or heavy lifting in the first couple of weeks. You'll feel it if you try, and you will know it's not a good idea. You can try some frozen peas or a bag of ice to the area for about 10 minutes. Take it off, let your skin return to normal temperature, and see if that helps. Some people feel it helps, other people feel it makes no difference. We don't do any splinting or wrapping of the chest anymore. That's actually been shown to cause pneumonia in patients with a rib fracture or rib bruise. So do not do that anymore. It's just the pain control and concentrating on taking a deep breath 4 times an hour or every 15 minutes, as well as taking a good cough every hour. After 2 weeks, the pain should be getting a lot better. You'll notice a big improvement. You'll probably also notice there's a niggling pain going on for many weeks or even months afterward, but that's okay. The major pain should be done within 2 weeks. Reasons to come back to the emergency room are if you develop a pneumonia. So it's a fever that's 38 degrees Celsius or 100.4 if you're using Fahrenheit, with a new cough. Come on back to the emergency room. I'm Dr. Atzema, and those are my discharge instructions for rib fracture or broken rib or rib bruise.